Welcome to Pulmonology Read Aloud to the CT Scan series. My name is Dr. Anshu Maneja Arora. I'm back with another video on the basics of CT scan for a pulmonologist. This video is based on your request for a specific video on how to read the lung segments on a CT chest. Since I am not a radiologist but a practicing clinician, this is a clinician's approach to how you can find out which segments are involved, which lobes are involved to guide your therapeutic procedures, diagnostic procedures and therapeutic interventions. So let's get started. So before you start reading a CT chest for the lung segments and lobes, you must remember all the particular segments that we see in our lungs. So let's do a quick revision. You all know that the right lung has 3 lobes, the right upper lobe, the middle lobe and the lower lobe, and the left lung has the left upper lobe, which has a superior upper lobe division and a lingular division, and then there's a lower lobe. Another landmark, another anatomical landmark that we all must know are the fissures. So we all know that there's a major fissure or an oblique fissure, and the right lung also has a minor fissure and the left lung has a major fissure. The upper lobe is divided into 3 segments: the apical, anterior, posterior segment, and the upper lobe on the left side is divided into an apico-posterior and an anterior segment. On the middle lobe on the right side, we have a medial and a lateral segment, and in the lingular division on the left side, we have a superior and an inferior division. The lower lobe contains of the superior lobe and the basals, which are anterior, lateral and posterior basal in case of the right lung. The left lung has a combined anteromedial basal and a superior lateral basal and posterior basal. So effectively we have 10 bronchopulmonary segments on the right side and 8 on the left side, because the apical posterior are together and the anterior medial are together. Also, when we look at the CT scan, then it's good to remember and replicate the image of what we might see on an X-ray, because an X-ray, particularly a lateral X-ray, is very helpful in delineating the lobes. So if you look at this, then we know that there's a major fissure which starts from T4, T5 and extends to the diaphragm on either side. On the right side, the minor fissure starts from the hilum to the 6th rib or to the chest wall. Now, anything which is above the minor fissure on the right side is the upper lobe. Between the minor and the major fissure in a triangular area is the middle lobe, and the rest, all of it, is the lower lobe of the lung. And on the left side, since we do not have a minor fissure, we have an upper lobe, we have a lingular area as a part of the upper lobe, and then we have a lower lobe. So keeping this in mind, always try to replicate this and you will be able to understand the anatomy on a CT scan as well. To simplify it, we all know that when we see a CT scan, we are practically seeing the patient from above. So what do we expect first? We expect to see the apical lobe and the apico-posterior lobe at a first instance when we start looking down into our patient on a CT scan cut. We go further down and we have the posterior segment and the anterior segment on the right side, and we have the entire anterior segment on the left side. When we go further deeper, we are going to meet the fissure, the horizontal on the right side, and the start of the lateral, the oblique fissure on both sides. And at this level, we should be seeing the superior segment of the lower lobe almost coming in the picture along with the upper lobe segments. And when we go down deeper, we should be seeing the medial, lateral, and the superior, inferior along with the start of the basal segments. So around the area of the hilum, we should start seeing not only the superior segment of the lower lobe, but also the anterior segment here in the right side, and we should start seeing probably some part of the superior of the lingula and the anterior. So this helps give us a perspective, and I am going to use this picture again and again in my talk to help you understand where we are on the CT scan. When you are looking at the CT scan, for a pulmonologist, a clinician, an internal medicine who's not a radiologist, I think we should stick to some basic landmarks that help us understand better. So for that, 4 landmarks are the best to understand the CT segments. The first one is before the trachea divides. So before the level of carina, this is actually at the level of the aortic arch on the simultaneous mediastinal cut. The second level that one should look out for is that where the left pulmonary artery comes in the mediastinal window. The third one should be the level of the right pulmonary artery, and the fourth level is the ventricular level. So I would like to clarify. So now we will be reading our CT scan at the level before the carina or the arch of aorta, the level where already the carina, the division has occurred and you get a branch for the right upper lobe. This is simultaneous with what you will see when the left pulmonary artery rises. The third, where the right pulmonary artery will arise, and the fourth level will be at the ventricular level. So as expected, before the division of the trachea, we should be seeing the upper lobe along the arch of aorta. So the right side and the left side, the upper lobes. When the left pulmonary artery divides, it's roughly almost where after the trachea has divided into right and left. So the right bronchi and the left bronchi. So at the level of the left pulmonary artery, here again we should see most of the upper lobes, but as I showed in that picture, we should start seeing some portion of the lower lobe also, because we will see fissures, the oblique fissure. When we go down deeper, we should start seeing some part of the middle lobe along with a lot of portion of the lower lobe, and then at the ventricular level we would obviously see more of the lower lobe and parts of middle lobe. So let's understand it. Let me run through this video and it will help us understand how to approach a CT scan. So when we are scrolling, we can identify the trachea. It is now going to divide, and we are seeing the fissure. We just saw a fissure here. Now is the division. We can see some bronchus. We can see the oblique fissure here, and that's it. So when we are looking at it this way, we first identify the major landmarks: the division of the trachea, the aortic arch level, the origin of the pulmonary artery. Now let's break it down further and see how to identify the individual segments. So let's come to our first level, which is the level of the arch of aorta. So this is what we are seeing, the level which is just below this. If you remember, as I said, we would see a lot of part of the anterior segment, the apical segment and the posterior segment. Mind you, we can also see the fissures here. So this is the start of the oblique fissure from T4, and here if we divide, we are seeing some part of the anterior and the rest of the part of the apico-posterior. So above the fissure, it's only the upper lobe, and in the upper lobe on the right side we see all the three: anterior, apical, posterior, and on the left side we should be seeing the apico-posterior as well as the anterior. When we go to the next level, remember this picture, we would see the left pulmonary artery rising. The trachea is already divided into the right and the left bronchi, and we can see the right main bronchus here. And then now at this level again we can see the fissures. So everything above this is the upper lobe. Below this is not the upper lobe, but it is not even the middle lobe, because remember we could see superior segments of the lower lobe. So we should be able to see superior segments of the lower lobe here, and here you can divide it into anterior part as well as posterior part. So the fissures, the anterior, the posterior, the apical is already gone, and again here anterior and apico posterior. So that's what we're seeing. This image also shows a part of the superior lingula which might be seen at this level, but it also depends on which cut you've used. Let's come to the next level now, which is the level of the right pulmonary artery. Now, the level of the right pulmonary artery is clearly much after the division of the trachea. So, you can see the right and the left, and now here you can see the division and the left main bronchus actually visible with the upper lobe division going here. Remember, the fissures are still visible, and this is the oblique fissure. And now here, what you can see is that since you are at a much lower level, you must anticipate now seeing the lower part of the lung, so the lower lobe. So this both are the superior segments of the lower lobe, and above it we can see some part of the anterior segment as well as the medial segment here and the lingular segments on the left. So you can see the superior lingular here. You can see the medial segment of the middle lobe also here, and the inferior segment lingular here. So let me label it for you. So medial segment of the middle lobe, some part actually is still the anterior segment, superior segment of the lower lobes. So below this, we are now expecting that when we cross this level, we should be seeing most of the lower lobe. So remember this image again. We are somewhere here. So if we are here, which is below the division of the carina, we should be seeing a lot of anterior segment of the upper lobe still on the right side, superior segments of the lower lobe both sides, right? And we should be able to see some of the lingular segments, superior and inferior both on this side, and the medial segment of the middle lobe on the right side. So this is where we are. And now when we go down, we should be seeing predominantly this part. So we should be seeing a lot of the medial segment of the right middle lobe along with the basal segments, and we should expect inferior along with the basal segments on the left. So this is the ventricular level. We are much down. We take a cross section here, and what do we see? We see the fissure on both sides. We can now see a lot of the middle lobe. The upper lobe has now finally gone out of sight. So we can see the middle lobe with the medial segment and the middle lobe with the lateral segment. So medial segment and lateral segment, and everything below this fissure now is your lower lobe. So lower lobe you can divide into a medial part. You can have the anterobasal, lateral basal and posterior basal. And same thing if you do on the left side. This is the fissure. So below the fissure you have, instead of medial you have anteromedial, we have a portion of lateral basal, and then we have posterior basal, and that's what we visualize here. So this is your ventricle levels. Right. Now at this point of time, a lot of you must be confused that we haven't really seen the minor fissure. So a minor fissure is usually seen on, when you scroll it, you'll see as a triangular, a section, a line, a fissure that's running through, and most of the fissures that you are visible are your oblique fissure. And so the minor fissure, and below that the middle lobe on the right side, we usually see at a level which is much below the division of the carina. There's also superior accessory fissure, as we may call it, which can actually separate the superior segment in the lower lobe from the rest of them. So this is what we'll appreciate here. coming back to where we started, so now we've all revised the right lung and the left lung and the segments, and it'll be helpful here to again understand the bronchoscopic view and realize that according to the segment we know that there are bronchial segments. So the international nomenclature of RB1, 2, LB1, 2, 3 and the middle lobe and the lower lobe, that should corroborate with it. So now I'm going to talk about the second way of analyzing the lung segments, which will take care of the bronchial anatomy also. So let's go into it. And at this point of time, let's remember again that the right side you have this is a very easy, simple mnemonic, a very common mnemonic. It's not what I have made. And it's called a palm seed makes another little palm. So you have the anterior, you have the apical, posterior. So apical, posterior and anterior segment, RB1, 2 and 3, with apical being B1, posterior being B2 and 3 B3. So APA, B1, 2, 3. Then the middle lobe, the lateral and the medial segments on the right side will be B4 for the lateral and B5 for the medial. Right lower lobe, SMALP, seed makes another little palm. So superior segment here is the B6, and then the medial basal segment follows B7, and the anterior basal segment will be B8, followed by the lateral basal B9 and the posterior basal B10. So this is how we remember the international nomenclature when doing bronchoscopy. And for the left side, remember Asia Alps. So the left upper lobe and the left lower lobe. So we start with A, which is apico-posterior, so it's B1, 2. Then we come to anterior segment B3. Then we have the superior, so apico-posterior B1, 2, anterior B3. Then in the lingula 4 and 5, which is in the order of superior and then inferior. So superior is B4 and then B5. And in the left lower lobe, again we start with superior B6, medial 7, ALP 8, 9 and 10. Now let's try to find it out on a CT scan. So let's start with the first one. Okay, let's see this CT as it scrolls. I'm concentrating on the right side here. You'll have the right main bronchus now emanating soon. So let's look out for that. So the right main bronchus, you can see that the right main bronchus is then leading into the B2 and the B3 here. We can't see the B1, but we can at least see the right main bronchus. You appreciate that, and it's going to B2, B3. So you would know that we are in the upper lobe, and we are seeing what is the anterior apical and posterior segments somewhere here. But here you can see the B2, B3. Let's go to the second image. Now let's go further, and now you can see this division. So the lower lobe and the middle lobe. So once we are seeing the bronchus intermedius, we can follow it through to see the middle lobe and the lower lobe segments. So accordingly, this should be the area of middle lobe, and if you look very closely, probably this is the minor fissure that is in the screenshot, and this is the lower lobe segment. So here B4 and 5 of the middle lobe, and here we are going to see the lower lobe segments, which will be B7, 8, 9 and 10. So by using the bronchial anatomy also, we can localize which segment the lesion is. Next, going to the left side. So now as the video plays, you can see the left main bronchus, and this left main bronchus is going to divide. And here it's behind the arch of aorta. This is going to the upper lobe division here, and you can see the lower lobe. So if you look closely, we can see the left main bronchus, and then we can see it dividing into the upper lobe division, which will be LB1, 2 and 3. And next we should be seeing the lingular. So we would see a superior lingular segment, and we'll see an inferior one, and then further we'll see the lower lobe segments which will follow. So this way we can identify the segments through the bronchial route, and also by looking at the landmarks, which are the fissures and the division of the trachea as well as the aorta. So let's quickly revise. This I've taken from Radiopedia because I found it really useful to understand. Let's try and name the segments as we cross them and quickly revise. So we can see most of the apical once we start scrolling down. Now we should see the anterior segment. First on the left, we are also seeing it on the right. At this point, we can see apical anterior posterior. We can see the superior segment of the lower lobe at this level. We still can't see the middle lobe segments. When we scroll further down and we are going to the ventricular levels, we will start seeing at that time the lateral segment of the middle lobe on the right. Now we see the lingular segments as well as the middle lobe segments. And remember that once we'll reach the ventricular view, the most of it that we'll see will be the lower lobe basal segments and the middle lobe segments and a little part of the anterior segment of the upper lobes. And now we can see most of the lower lobe basal segments, some middle lobe and lingular segments. And that's how we localize where we are in the CT scan. Let's take an example of one of my patients and let's see what we can localize. Here we start scrolling down. We see the trachea will divide now. We are at the almost at the apical segment. You can see some changes on the left side, and if you look at this, then there is this fissure delineated, and along the fissure we could see the lesion. The lower lobes are fairly okay. So where are we? Where is the lesion? So if you remember this view, this was the fissure. Below this is the lower lobe superior segment, and my lesion was here. So if my lesion is here, then it's in the apico-posterior. So it's in the left upper lobe in the apico-posterior segment. If I want to do a bronchoscopic examination, that's where I should target, and I will hit the jackpot. So this is how we basically use it. One last slide where we can just quickly revise. So before the arch of aorta, or rather just when you can start seeing the arch of aorta, you would see the right side, anterior apical posterior, anterior and apical posterior. Once you've crossed the arch of aorta and the trachea starts dividing at this level, or rather at the level where the pulmonary artery is coming on the left side, you would see a lot of the posterior segments here, still anterior apico-posterior on this side, and some of the lateral segments of the middle lobe. We reach at the other level, which is down, and here this is almost the level where you will see the right pulmonary artery. You see a lot of portion of the superior segment of the lower lobes. Below the fissure, you started seeing some of the medial lateral segments. You also see a lot of anterior segment, but this cut is basically below that level. And when you're purely at the ventricular level, you can see the middle lobe, the lingular, and all the basal segments down. So I hope this video has helped you understand how to localize the segmental anatomy on a CT scan. It's not a read aloud of an article or a guideline, but because a lot of you were interested to know that, I tried to put in my own experience of how I use it, backed by some evidence, some pictures from known sites. So that you can also understand the same. If there's still any doubt, please get in touch with me by messaging in the comment box. Do like, share this video with your friends. Happy reading, and I'll see you soon with another video. Thank you and bye.